Gotta be quiet. Hello. For my project, I did Postpartum Depression by me, Valeria Perez. Um, oh, hold on. I don't know how to use this. I don't see the captions. It shows when you download it. Okay, we'll see. We'll see. Okay, so the definition of postpartum depression is a mood disorder that can affect women and um, that can affect women after childbirth, characterized by a feeling of extreme sadness, anxiety, exhaustion, and interfere with daily functions. So, pretty much, depression, the only thing is like this affects women after childbirth or even before. Um, going, oop. Now, there is signs and symptoms. Key signs include persistent sadness or low mood, loss of interest in activities that were once enjoyed, fatigue or low energy, difficulty concentrating, changes in sleep or appetite, feeling of guilt and worthlessness. In severe cases, also harming oneself or their baby. Um, Causes and risk factors. Common causes and contributing factors would be hormonal changes after childbirth, a history of depression or anxiety, stressful life events such as financial difficulties, lack of support from family or even friends or even community, complications during pregnancy or childbirth. So complications like having a hard time breastfeeding, and then just having severe symptoms throughout your pregnancy. Um, Prognosis, the condition can improve over time, especially with treatment. So, therapy and having support. Many women see improvement within a few months, but some may experience symptoms for longer. Early intervention can lead to quicker recovery. So, just having knowledge of just being aware that this is a possibility. And then the demographics, it affects approximately 10 to 20% of new mothers, most common in women ages 18 through 24, and can be um, prevalent among lower socioeconomic groups. So within this age range, you face a lot of barriers, like you may not be financially ready to have a child. So then there's that stressor. Racial and ethnic disparities exist. So there's higher rates in minority populations due to other stressors with that as well. Um, so some barriers, and I kind of divided them. There's the social and attitudinal barriers. So, like I mentioned before, a lack of awareness about postpartum depression and its risk factors among the public and sometimes among healthcare workers. So, sometimes your healthcare providers don't have the knowledge to help you, or they're not really looking out for that because it's not really talked about. Uh, so, you know, their lack in seeing the signs and somebody as well. Culture expectations among motherhood. So, just those common expectations of like, you're having a baby, you should be happy. Financial, high costs and inadequate insurance coverage for mental health services. So, not being able to have those opportunities to help yourself. A shortage of providers who accept Medicaid. A lot of people are on Medicaid and just not being able to get those services uh, solely because they're not covered. Systemic and logistical, long wait times for appointments or crisis services. So, let's say you are trying to receive some of these treatments, but um, it just doesn't align with your schedule. That is a big one. And not having like enough support and outreach, lack of clear referral protocols or follow-ups from obstetrics and gynecology practices. So just having those follow-up referrals, same thing, like you're not gonna want to reach out when you're low. Um, Shortage of mental health professionals trained to treat postpartum depression and early hospital discharges after delivery. So not seeing those signs, like your care team not seeing those signs and just, dispatching you and deeming you ready, especially as a newly mother. Individual and environmental lack of support from your partner, family, or friends. History of depression or other mental health issues, stressful life events such as financial difficulties or relationship problems, um, lack of culturally competent care and language support. All right, accommodations, the healthcare system level. So having screenings for postpartum depression during pregnancy and postpartum visits to provide a rapid referral for treatment. Just caring for your patients or like being able to read those signs. Initiating treatment or referring to mental health resources within the OBGYN practice. So your OGBYN, that's where you're usually going with your visits. So like having those resources there is a big one. Improving insurance coverages for mental health care. So yeah, implementing integrated services delivery models that improve communication between crisis and long-term support services, increasing training for providers to build confidence and competence in addressing postpartum depression, extending the duration of follow-up care beyond the initial postpartum period to make sure mothers are all right mentally, being that like this is a conversation that's being brought up and not shied away from. Community level, providing support groups and other resources such as yoga and meditation. So these are really good. But just having like more of that really helps. You can find a community. So going into community resources, when is Postpartum Support International, and their website is postpartum.net. And then this one offers support groups and resources for women experiencing postpartum depression, and it helps them connect with others and those who also understand their struggles or have been through it. Another one would be the National Alliance on Mental Illness, NAMI. Their website is NAMI.org. And then this one provides education and support on mental health conditions. And it does talk about postpartum depression and advocates for better mental health care. Okay, some facts about postpartum depression. It can occur at any time within the first year after childbirth. So that's a little scary because it's like you give birth and like this is still a possibility. It can affect fathers and partners, although it is less frequent and frequently discussed. And then women with a history of depression are at a higher risk for developing postpartum depression. And then treatment options include therapy, medication, and support groups. Postpartum depression impacts the mother-child bond and the child's development if left untreated. So I'm at the library. It's a little loud. We can pause for a bit. Okay. Some sources that really helped was the Postpartum Depression, a review, and then that was the source. And then another one was the postpartum depression facts and statistics. So if you want to go in and do a little bit more research on postpartum depression, there's that. All the images I gathered from Google. um, and then let's see, personal and career connection. So I am a health science major and I'm interested in nursing. So learning about postpartum depression is crucial for my career in healthcare because it just allowed me to kind of better understand and support a patient who may be experiencing mental health challenges after birth. So, yeah, just reading the signs and being aware that like mental health is important and also within the father. So that was something very interesting that I learned. So thank you for listening. Um, and that was my presentation. Ooh. How do I pause this? Stop video. Oh no.